conclude the hearing on Assembly Bill 430 and invite down Dr. Titus and invite up Mr. Oscarson, and we will open the hearing on AB 340, which makes various changes concerning the acquisition and use of opioid antagonists by schools. And if Assemblyman Hambrick is listening, we hope you are doing well, and we are sorry that you're not able to participate with us today, but we're sending you our best wishes when you're ready.
Thank you, Madam Chair and members of the Health and Human Services Committee. I am Dr. Robin Titus, Assembly District 38, which is most of Lyon County and all of Churchill County. And I'm honored to sit here representing Assemblyman John Hambrick, who is representing Assembly District 2. And we are presenting AB 340 for your consideration. And I can assure you, John and his wife, Assemblyman Hambrick, is watching. We've been texting during this hearing, and he is following right along, and he is truly sorry he can't be here, but trust me, he really is here. So Assembly Bill 340 is a bill that will allow public and private schools to address the issue of opioid overdose in their school population. This bill does not mandate the school carry opioid antagonists, but gives them the ability to obtain, store, handle, and transport opioid antagonists, and exempts them from certain liabilities when the use is necessary and certain conditions have been met. It establishes storage, handling, and transportation requirements and requires a reporting to the Department of Health and Human Services of doses administered by authorized personnel during each school year. That's a very brief summary of the bill, and now also with us is former Assemblyman James Oscarson, who's worked very hard on this whole opioid crisis and can present some more specifics about AB 340.
Welcome back, Mr. Oscarson. Please go ahead.
Thank you, Madam Chair. It's an honor and privilege to be here. Thank you, Dr. Titus and members of the committee. I'm James Oscarson, former Assemblyman from Assembly District 36. And just for the record, Madam Chair, I'll do my speed reading voice because I know your time is limited. I'm pleased to be here to present Assembly Bill 340, which authorizes public and private schools to obtain and maintain opioid antagonists under certain conditions, not required. I am here at the request of Assemblyman Hambrick, who, as we know, is unable to be here. Mr. Hambrick has also been texting me, sends you his best, and he certainly misses seeing each of you every day. Before I review the specifics of the bill, I would like to provide a bit of context. Many of you may remember seeing a similar bill last session, AB 428. Like the bill before you today, Assembly Bill 340, the 2017 legislation was amended to authorize a pharmacist to furnish an opioid antagonist without a prescription under certain circumstances. In addition, the 2017 bill prohibited the development of standardized procedures and protocols that would prevent a pharmacist from dispensing an opioid antagonist without a prescription. So here we are again 2 years later with greater knowledge of the importance of opioid antagonists. Drugs like Naloxone, also known as Narcan, and the successes we have seen in reversing opioid overdoses with these antagonists. And here we are again 2 years later with nearly 100,000 lives lost nationwide since the 2017 from opioid overdoses, asking for the simple authorization to allow schools to keep opioid antagonists on hand in the event of an overdose. The past 2 years have seen a nationwide trend toward authorizing the use of opioid antagonists in schools. While we do not have exact data, we know that at least 12 states, including Connecticut, Indiana, Kentucky, Louisiana, Maryland, Massachusetts, New York, and New Jersey, and New Mexico, Rhode Island, and Tennessee, have statewide or school district-specific programs allowing for the use of opioid antagonists in schools. As recently as last week, a similar bill in Oklahoma, Senate Bill 85, which passed unanimously in the Oklahoma Senate, received a final committee approval in the second House and is on the verge of being approved in its assembly. We are seeing incredible movement on this issue across the United States, and it's time to take this important step forward here in Nevada. I hope you agree. If there is a silver lining in all this, it's the fact that opioid overdose deaths have remained flat in Nevada. Between 2016 and 17, the latest year for which we have data, according to the Office of Analytics And in Nevada's Department of Health and Human Services, there were 387 opioid-related overdose deaths in Nevada in 2016 and 338 in 2017. Of those deaths, 34 were in the 15 to 24-year age group. 37 were reported in the age group in 2017. What we do not know about this age group, however, is how many overdoses occurred at schools and how many of those deaths could have been prevented had an opioid antagonist been available for use. In an emergency situation at school, I would argue that even if one young life can be saved, the passage of AB340 is worth it. With this background, I'd like to take you to a moment to briefly review the primary components, as Dr. Titus did, just in a little more depth, and I apologize, I'm reading as fast as I can, I promise. First, the bill authorizes a healthcare professional who is authorized to prescribe an opioid antagonist to issue an order allowing a charter, private, or public school to obtain and maintain opioid antagonists on campus. This order is permitted regardless of whether a person at the school has been diagnosed as needing the antagonist. This measure sets forth the specifics of the order and declares that the healthcare professional shall not be subject to disciplinary action solely for issuing an order. Assembly Bill 340 provides additional protections for healthcare professionals by declaring that he or she is not liable for any error or omission concerning the acquisition, administration, possession, or provision of an opioid antagonist maintained by the school under the order. Liability exemptions are also extended to pharmacists who dispense an opioid antagonist or who transfer an order to another pharmacist at the request of the public or private school. With regard to administering and storing an opioid antagonist at school, AB 340 models its use and storage much like that of the EpiPens, which are already permitted for use in schools. School nurses and other designated employees at the school may administer an opioid antagonist maintained at the school to any person believed to be experiencing opioid-related drug overdose. The governing body of any charter or private school and the board of trustees of each school district must adopt a policy to ensure that emergency assistance is obtained each time a person at the school experiences an opioid-related drug overdose. A policy must also be adopted requiring notification of the parent or guardian of a student who has administered an opioid antagonist. Finally, much like the protections afforded to healthcare professionals and pharmacists, Assembly Bill 340 extends exemptions from liability to the school, school district, employees, and others affiliated with a school from certain damages related to the acquisition, administration, possession, or provision of an opioid antagonist or EpiPen, which is not resulting from gross negligence or reckless conduct. Madam Chair, I had some personal remarks I was going to share, but in lieu of time, I won't do that. Again, I'm grateful to be back in front of you and grateful for all the hard work I know you're doing up there. I know it's crunch week, and I remember that well, so very supportive of your efforts and appreciate all you're doing. This concludes my presentation. I urge your support of AB 340. I know there are others here today who also wish to speak in support of this important legislation. And I thank you for your time, Madam Chair and committee.
Thank you, Mr. Oscarson, and we certainly appreciate your pitch hitting for Assemblyman Hambrick. And I do have to say I was remiss in I didn't think that Mrs. Hambrick would be listening, so we are also sending our best wishes to Mrs. Hambrick and hope that she's doing well. Would you like to take questions now, or do you want to move on to more support?
Whatever the committee
Whatever
would
you'd
like us
to do, Madam Chair.
Okay, thank you. Do I have any questions? Okay, Assemblywoman Nguyen.
Thank you, Madam Chair. You had mentioned something about how schools already have programs in place for like EpiPens or like allergic reactions. Does this kind of model some of the same liability, like waivers and information that's included in that?
I'll take that if it's okay with you, Mr. Osterson. Yes, it does, and it almost mirrors it, if not models it, on what happens with the EpiPens. And just also a really important point here is that schools do not have to do this. This is an optional program, and some districts may find that this is something they need. Others may feel that this is not something that they would want to deal with, just as with the EpiPens. And so it does very much model the EpiPen.
I also have another question. And now I'm blanking on it. It's a long day. Yeah, I don't remember.
We can come back if if you recall, later. And I have a question about training, and I'm sorry I stepped out for a moment, but I don't think I missed it. I was a little concerned because we know that in a lot of our schools, there isn't a nurse on staff full-time, and I know the bill allows for someone else to be designated, but I'm a little concerned about that person not necessarily having the proper training and medical background. Can you please address that?
We've actually, Robin Titus for the record, Assemblywoman Titus, when Narcan was first available, or the concept of an opioid agonist available to not just school districts, that's what this addresses, but families and friends and the patients when the prescription opioid was originally given, there's a policy and a program that the pharmacists already have in place before they dispense it. So this whole program isn't about having to be a healthcare professional to administer Narcan. Quite the contrary. The police officers administer it. It doesn't have to be a designated first responder other than whoever's there at the time. And so we're encouraging it not to be limited to a healthcare professional. Frankly, some pharmacists with the training, once you're prescribed it or once the pharmacist gives it to you, you do have to acknowledge the training that they're going to give, but in no way is this entailed to be a healthcare professional only.
Thank you for that. But without the healthcare training, how do you know that it's an opioid
Well,
problem?
there is training you have.
Or, I mean, I'm sorry,
Oh,
right, I mean.
but you're asking,
You're
how do
getting
you-
training for this, but you're not a
Right,
healthcare
exactly.
professional, so
The-
how do you know how to recognize?
And
if-
that's the difference in the school here is that you have to have some base understanding what an overdose might look like, as opposed to a diabetic. Let's say they suddenly are unconscious. The person is a known diabetic child. Those kind of things. You would have to know the difference. So you're absolutely correct with this. But Narcan can be prescribed to a family member or given to the patient themselves when they pick up their prescription for the opioid. It's in the same bag. So it's not specifically limited to a healthcare professional to give Narcan now. However, you do have to recognize, and that's what part of that training is, before they dispense the Narcan, here's the signs of possible overdose. So there's some risk involved as far as you have to have certain knowledge. It wouldn't be just anybody that would be able to administer this in the schools. Then that's where the statement says they were going to have to develop the program and they're going to have to, have that. So it'll take a school having to have some education, obviously, and some understanding of who they would be willing to have access to that Narcan.
Thank you. Assemblyman Thompson.
Thank you, Madam Chair, and thank you, Dr. Titus, and good seeing you, my good friend, Mr. Orenshaw. I mean, not Oscarson. I'm sorry, Oscarson. It was an O. You know I know you. All right, don't.
He's a senator now. He's a senator now, Assemblyman.
Just a question about like the three types of schools. So you have the public school, you have the private school, and you have the charter school, but it seems like everyone's protocol is a little bit different when I'm reading through it. Like, you understand what I'm saying? Like, who can administer and who needs to be trained? It seems like in the charter school section, that might be the best route, where it says they get the order from the healthcare professional, and then at least 2 employees are authorized to administer, but I don't see that in the public or the private schools. So can you kind of shed some light on that?
Mr. Oscarson, would you be able to address that? I feel that some of the public schools will have a school nurse, and perhaps they have a more of a nurse professional in their buildings, whereas the charter schools frequently may not have one. But that's just an observation, and I can't address the detail on the actual wording.
Madam Chair, through you to Assemblyman Thompson. I think that certainly those are discussions that can be had with Assemblyman Hambrick and Assemblywoman Titus as to some standardization. I know that in my presentation I specifically referenced that the governing body of any charter or private school and the board of trustees of each school district must adopt a policy to ensure that emergency assistance is obtained. So I think that that sets the stage, if I'm not mistaken, for them to be able to be consistent or not consistent. And Dr. Titus is exactly, Assemblywoman Dr. Titus is exactly correct when she says that many of the private schools and charter schools may not have a nurse. So the training is a component that I'm sure that the pharmacist is important to them, and perhaps a physician that works with the school or works with the school on some other basis could certainly walk through. So that would be my hope, Assemblyman Thompson, and I believe that there can be some standardization, yet there are some differences in the ability for them to have staff.
Thank you, Mr. Oscarson.
Assemblywoman Nguyen.
I remembered. I didn't see anyone signed in either opposition, support, or neutral from any of like our various school organizations, Clark County School District, or any of the, I don't know, any people related to education. Have you had much input with them or collaborated with them to see what their input and their concerns are on this?
Assemblywoman Titus, for the record, and I was not part of the negotiations to the initial drafting of this bill, so I do not know who Assemblyman Hambrick reached out to and their participation. So I do know when we did the EPI bills, there was many folks at the EpiPen bills, that there were many folks at the table from all the different school districts, and I do not know who was reached out to about attending this particular hearing, so I cannot answer that question.
Madam Chair, if I may respond.
Yes, please go ahead.
I did see a couple letters that were concerning that they would be forced or would have to have this product. I think we've clarified that it's not a mandatory program, it's an optional program. Usually when my experience has been when they're optional, there's not much pushback for those kinds of things, but indeed I do know that there were some letters received about that, and I think those concerns were clarified.
Thank you, and I do see some school district representation that I think will be coming up shortly. Is follow-up or no? Okay, Assemblyman Asefa.
Thank you, Madam Chair. If you can take us to the genesis of this bill, how much of overdosing is it happening in the schools that this is necessary? I mean, it definitely doesn't hurt to have it, but do we have data that show this thing is necessary?
Assemblywoman Titus for the response, and I'm going to turn this one to Mr. Oscarson because I think he gave the data earlier in his report. Thank you.
Please go ahead, Mr. Oscarson.
Thank you very much, Madam Chair. I think that, and I know I read it quickly, so let me I'll just review it very quickly. According to the Office of Analytics in Nevada's Department of Health and Human Services, there were 387 opioid-related overdose deaths in Nevada in 2016, 388 in 2017. Of these deaths, 34 were in the 15 to 24-year age group, and in 2016, 37 deaths were reported in this age group in 2017. So we do not know how many of those happened in schools. We don't have the 18 data yet. We don't know how many of them happened in schools. We believe one is far too many. I hope that answers your question, sir.
I get the numbers, but are you saying that you don't know if none of these deaths occurred as a result of overdose on school properties?
That's correct, sir. We're not aware that any of them happened or did not happen on school properties.
Thank you, sir.
We don't have access to that data at this point, sir.
Appreciate it.
Thank you, Mr. Oscarson. Mr. Thompson.
Thank you, Madam Chair. So with following on what Assemblyman Asefa was saying, so do we have some type of preventative campaign included with this? Because I understand, I totally get it, one is too many, but if we don't quite know the number, is this bill going to address any type of prevention?
Assemblyman Thompson, through you, Madam Chair, to Assemblyman Thompson, I know that there's campaigns, no to drugs, all those kind of things that are going on consistently in schools. I know even down to the grade school and lower level grades are talking about, the DARE programs and those kinds of things that are addressing drugs and those kinds of issues. This particular bill, I don't believe addresses that educational component, but you would hope that throughout the process that this would just be another tool in toolbox to help assist in those kinds of concerns and that all parents share, I think, unfortunately, and in the system we live in today, it's important to have every tool available in the toolbox to address these concerns, whether they happen accidentally or intentionally.
Thank you very much. Seeing no other questions, we'll invite up support in Las Vegas or in Carson City. Anyone in support, please fill in the chairs. Please go ahead.
Good afternoon, Madam Chair, members of the committee. My name is Trey Delap, and I'm with Group 6 Partners, and one of our policy objectives this session has been to reduce barriers to recovery from addiction. Death is a barrier to recovery from addiction. The idea of this bill from last session continuing on is a good part of a harm reduction strategy. It was already mentioned that a number of states have this empowering legislation for their schools. The National Association of School Nurses also endorses this because they consider themselves on the front line of public health, and they're also there as primary first responders in many cases. In Nevada, if you go to the Southern Nevada Health District and you attend a 20-minute training, you can get an overdose kit. This overdose kit includes Narcan nasal spray. This is part of the opioid state targeted response grant, so all of this has been paid for by the federal government. This program started in March of 2018. Since then, 1,729 people have been trained in the use of the Narcan kit, and they've issued 6,367 kits out into the community. The reason I bring that up, although it's not related specifically to the school, any member of the community who wants to get access to Narcan can get it. So we would certainly support that anywhere it can possibly be obtained. And with that, we hope that this will reduce the number of opioid-related deaths in Nevada. The statistic has remained static. One thing that I would also like to mention is on the federal side, a couple years ago, the Bureau of Indian Affairs asked their Indian Health Service officers to start carrying Narcan with them because they were often first responders. The VA realized that co-prescribing and training the Narcan when they were using opioid treatment was important as well, just because of having it in the home and public safety from that regard. There's also an organization in Southern Nevada, Track B, which is a needle exchange and has a vending machine that will exchange needles that is currently operating, and they have this available as well, and they estimate that at least one person a day asks for treatment or help with curtailing the opioid use disorder and getting into treatment. So that's a very encouraging thing. So there's stuff happening on the ground, at least in Southern Nevada, that we're aware of. So I urge your support of this as well. Thank you.
Thank you very much. And Mr. Delap, do you know if you're dealing with a minor, does an overdose on opioids mimic any other medical condition?
Madam Chair, Trey Delap for the record. The training that you will get if there's a suspicion of overdose, someone is, for whatever reason, the protocol would be call 911, administer the Narcan. If the person is an overdose, it will work. If the person is not overdosing from an opiate, it will not work, and it will actually have no other effect. So it does not require any judgment in the administration of this. What you're kind of asking about is the other part of this bill, which deals with the Good Samaritan law and the immunities that are in there. And that law was passed in 2015.
Thank you very much. Seeing no other questions, we will move on to opposition. Anyone in opposition, please fill in the seats. Please go ahead.
Madam Chair, members of the committee, Graham Galloway on behalf of the Nevada Justice Association. Let me begin by saying this is a good bill. The goal and intent of this bill is worthy and is excellent, but it's not a perfect bill. It's not perfect because it provides gratuitously and without any real justification immunity to everybody who comes within the terms of this bill. This is troublesome. A cornerstone of our civil justice system is that everyone should be accountable for their actions. This bill doesn't do that. It gives individuals a free pass if they're negligent in the distribution or application of these antagonists. I have not heard anything today or at any other point that would justify this radical change in our civil justice system. In fact, this bill, instead of what you want people who are going to distribute and use these antagonists to be on their A game, to be at their best. This bill doesn't do that or foster that. In fact, it sanctions and allows for incompetence. It waives any negligence on the part of any of the actors involved under this bill. Bill Belichick, the coach of the Super Bowl champion New England Patriots, said it best. A simple little saying he says to all his players: do your job. If you do your job diligently, you don't have to worry about litigation, being sued, responsibility, accountability. That's the problem with the immunity provisions in this bill. We are big proponents of the largest or the distribution of these antagonists to anyone and everyone who are going to use them correctly. But that goal shouldn't be at the expense of one of our core values of the civil justice system, which is accountability, responsibility, and liability. Unfortunately, we have to be in opposition with this language, this immunity language that's in the bill. If the immunity language is withdrawn, we would be enthusiastic, happy supporters of the bill. Thank you, Madam Chair.
Thank you very much. Do we have any questions? Okay, seeing none, and seeing no one else in opposition, we will move to neutral. Please come fill in the chairs. Please go ahead.
Thank you, Madam Chair. For the record, Lindsay Anderson, representing the Washoe County School District. Your committee has already addressed many of the things I was going to say, so I won't reiterate. We're here in the neutral position because it is enabling and not required. But I did just want to reinforce that in the Washoe County School District, we have roughly 100 school sites, and we have around 30 registered nurses that serve those schools. So we do not have a medical professional in each school building. We do have what we call clinical aides in each school building, but I just wanted to make it clear that they are not trained medical professionals really in any way. They do receive some training about how to handle medical situations, but they are not educated as a medical professional. So I worked for many hours way back in 2013 with Assemblywoman Smith and then Senator Smith on the epinephrine requirement, and I did want to clarify that stock epinephrine in our schools is a mandate. That's a little bit different than this as being as permissive. So I do think I can't miss the opportunity to say how much we wish we had a school nurse in every single school building and how important that would be to meeting the health needs of our students, but at this time we do not. I can't say whether or not my district would take advantage of this program or not. I won't reserve any fiscal comments on the cost of stocking this at each school, but because it's permissive, at this point, we do not have a particular concern in terms of a mandate. So I'm happy to answer any questions.
Thank you very much. Do we have any questions? Okay, seeing none, I will invite Dr. Titus back up if you'd like to make any concluding statements, or Mr. Oscarson if you'd like to make any concluding statements. Please go ahead.
Madam Chair, if I may, and then if Dr. Titus can finish up, that would be great. I listened to the testimony. Certainly, I understand the concern the gentleman brought forward about the cornerstones and all the things that go on with the ability for us to work. But I think one of the key things he mentioned in his testimony, I believe the word responsibility came forward. When you're responsible, sometimes you do things to be responsible and take care of concerns and questions that happen. 1,700 kits have been distributed in Clark County, in addition to, I think, 6,000 some odd that have been available. I think I would much prefer myself. I can't speak for other people, but I'd rather err on the side of caution and save a life of a young man and face my maker that way. I appreciate the opportunity to testify. I appreciate Dr. Titus and her diligence. I know she's one of the sponsors of this bill. And again, my gratitude and appreciation to the committee for listening. Normally I'd say I ask that you would pass this bill, but I will go as far as, while it's not very, it's kind of pathetic actually, but I'll beg you to please pass this bill. I'm happy to be a part of it and hope you see the importance of it as I have over the last 4 years. Thank you very much, Madam Chair. A pleasure to be here, and I wish you all well and miss you all very much.
Thank you, Mr. Oscarson. We miss you as well. Please go ahead, Dr. Titus.
Assemblywoman Titus, for the record, and thank you all for your good questions. I appreciate it. It's not an easy task, and it is a medication, and so everything needs to be discussed. I appreciate the Justice Association coming and saying their concerns. One of the hallmarks of this bill in the very title was providing immunity to certain persons for acts of omission relating to acquisition, possession, et cetera. And they did come up with an amendment moments before we met today. I did not feel I was in any position to accept that without Assemblyman Hambrick's really thoroughly vetting that amendment, because it added in the term negligent, unless negligence before each chapter. And so I was concerned that would then change the whole attitude of this bill, and had some concerns about that. But that does not mean that Assemblyman Hambrick would not accept that. So that's still open, as I'm here as his surrogate today, really. And again, as I said, honored to do so. Just as a point of clarification also, and to piggyback on what Mr. Delap said, I'm not sure how you pronounce his last name. But in any case, indeed, the risk of administering the Narcan is negligible, except people usually are very angry with me when I do give them Narcan because they go through immediate withdrawal. It's not a good feeling. But if somebody shows up and they have some other medical problems, we don't know, and while we're trying to figure out what that is, in the emergency response, we give Narcan, because until we can, if they are overdosed, it does work right away. And so while we're trying to, if it doesn't work, obviously we're going to work up other things too. So that's the beauty of Narcan and this whole process. So again, thank you for hearing this bill. Thank you for your thoughtful questions. And I appreciate and honored to represent Assemblyman Hambrick at this time. Thank you.
Thank you very much. And with that, we will close the hearing on AB 340, and we will move to our work session. Before we do that, just some housekeeping. So for the bills that were heard today, please, if you're an interested party and you're thinking of submitting a proposed amendment, please get those to us as soon as possible, but no later than 2 p.m. tomorrow. And also, please make sure that the bill sponsor knows that you're providing us with a proposed amendment, and let us know if